begin with hydration needs. Forewarning, I will spend the most time on this topic because it's a primary concern. Now, it's well understood that individuals with ostomies, and even more so ileostomies, are at an increased risk of dehydration. Dehydration is actually the most common reason for hospital readmission by individuals with new ileostomies during that early post-operative period. Now, let's not leave out individuals with colostomies. The number one concern of the clients I see who have colostomies is constipation, and even mild dehydration will directly impact constipation. So hydration is likely equally as important to individuals with colostomies as it is to individuals with ileostomies. I don't want to go overkill on the importance of hydration to quality of life because, like I said, it is well understood. We need adequate fluids for every function in our body, regulating body temperature, delivering nutrients to cells, for digestion and prevention of constipation, which in our case could mean bowel obstruction. We need adequate hydration for excretion of byproducts. And even if we don't understand the physiology of hydration, we know from practical experience that when we are dehydrated, we feel crummy, we experience fatigue, our skin is dry, we get more headaches, etc. So we know being adequately hydrated is important. It's so obvious to us that hydration impacts our quality of life because the symptoms of dehydration are fast acting. So we as ostomates learn pretty quickly when we are in fact dehydrated and either need to go into the ER for fluids or recover at home. I see low-level chronic dehydration in most of my clients. How do I know this? Well, we'll work on hydration and suddenly my clients will say to me, hey, I can finally mow the lawn again. Or I have the energy to walk out to the mailbox, or I finally have a steady stream of urine and don't have to push to initiate to go to the bathroom. These are very basic quality of life issues that can be helped with just a correction in fluid intake. And that's just referring to mild dehydration. Today, I really want to talk about the long-term effects of chronic and acute episodes of dehydration. It's important to understand that many episodes of severe dehydration will take a toll on the body. And while replacing fluids in the ER may make us feel back to normal symptomatically, it doesn't mean that there aren't residual effects on the other organs. And I'm specifically referring to our kidneys. So next slide, let's break it down. Here's a beautiful picture of a kidney. So when we eat and drink foods, the body absorbs nutrients, and those nutrients are transported all over the body, right? Whatever our cells don't use, the leftover waste, the kidneys are responsible for filtering out from our blood so that it can exit our body through our urine. Now, if you rewind for a second here, when that waste gets to the kidneys, it needs to be diluted by a certain amount of fluid. And when there is not enough fluid, the waste, or solutes rather, have the opportunity to form crystals, and the crystals can turn into kidney stones. Now, kidney stones are talked about in the ostomy community, but definitely not enough. I personally had them my first few months with an ileostomy. I had no clue I was at an increased risk. Kidney stones can be incredibly painful and impact quality of life, but they're not the only concern. We are worried, in addition to the stones, of the health of the kidney itself. The cells that make up the kidneys are incredibly sensitive to solute imbalances, the ones that we just spoke about, when there's not enough water to dilute these solutes. And the cells of the kidney can become damaged over time as a result of recurring episodes of acute dehydration. Next slide. So the episodes of acute dehydration that require hospital admission in individuals with ileostomies have actually been documented and researched, and a strong association was found between individuals with new ileostomies, acute kidney injury, AKI, and subsequent kidney disease. Now let's do an exercise. Imagine you are just diagnosed with diabetes. Likely, as a newly diagnosed diabetic, you will meet with an endocrinologist who will say, if you do not manage your diabetes, you will be at a higher risk of heart disease, a higher risk of stroke, a higher risk of nerve damage, a higher risk of vision loss, and you will have an increased risk of developing kidney disease. These risks are well established and communicated to patients and can easily be found on just a simple Google search. Now, return to being an ostomate, and let's ask ourselves, why is it that when we get an ostomy, we aren't told about the increased risks of not managing our ostomy. Why aren't we told of the risk of developing kidney stones and kidney injury and potentially kidney disease in the presence of acute and chronic dehydration? I'm honestly not sure what the answer is, but I do know that one of the reasons I wanted to talk tonight is to bring awareness to this topic. So given the understanding that hydration is so important, let's talk practically how we can better manage our hydration to reduce our risk and protect our kidneys. Next slide. Okay, so fluid needs, we know, are very individual and can vary greatly between ostomates. An ostomate who is very active and lives in a warm and sunny state like Florida will have different fluid needs than an ostomate in the winter months of New England who lives a sedentary life, right? How on earth are we supposed to get on the same page about recommending fluid needs to clients when there's so much variability? The best way for clients to properly establish what their individual hydration needs are is to have clients learn how to assess hydration status before they even leave the hospital. So how do we do this? We teach ostomates about how much urine they need to produce each day to keep the kidneys happy, because these numbers are far more consistent across the board than the amount of fluid that you need to drink. For example, the average individual with healthy kidneys needs to produce about 1.2 liters, 1,200 mLs of urine a day. Regardless of their activity level or where they live, they need to drink an amount that produces around this much urine. For someone who produces kidney stones, this number may move up to 1,500 mLs a day in order to better dilute their urine. And this number can change depending on other factors, so it would be helpful to discuss this goal with your provider. But once you know that number, you have a better metric to assess hydration, right? Because if you're making less urine than your target amount, then you just need to drink more. Okay, now how do we actually measure urine? Well, you know how you're sent home after discharge with that lovely tall container to collect ostomy output? Well, what if you're given a toilet hat? That same plastic hat they ask you to measure your urine in at the hospital. Measuring your urine will tell you very quickly if you need to troubleshoot your hydration. Measuring your urine at the beginning of your ostomy journey will be much more effective at helping you understand your needs than troubleshooting hydration, but from just trying to alleviate the symptoms of dehydration. You can walk around with chronic dehydration and be totally functional, just as I mentioned with some of my clients. In fact, many people do this regardless of having an ostomy. But the cost to our long-term kidney health is much greater because we are at an increased risk of acute dehydration, acute kidney injury, and therefore chronic kidney disease. So next slide. What is the takeaway from this principle of ostomy nutrition? Number one is to fine-tune your hydration needs with your provider. If you are someone who suffers from chronic dehydration, propose this idea of measuring your urine and find out from your doctor, specifically with your medical history, how much urine they expect you to produce. Measure it, see where you're at, and troubleshoot from there. Troubleshooting is where you may need some support. You may have to work with a dietitian or even your doctor to figure out electrolyte needs, electrolyte products, at-home recipes for electrolyte rehydration solutions, and the possibility of also regular outpatient IV fluids. Now, this next takeaway, to keep track of your ER visits, is very important because the long-term effects of dehydration risks to kidney health is not well conveyed to us. And patients will often head to their local ERs for fluids to correct for dehydration. And they will do this for years without ever telling their doctors because they think it's just an acute issue that needs fixing. And once they get the fluids, they are good to go. Doctors need to reinforce to their patients, if you go to a standalone ER, even if you go to the ER within the hospital that your doctor works in, the doctor should be notified of these bouts of dehydration. It's an important piece of your medical history. Same goes for recurrences of kidney stones. There's actually a case of a patient with an ostomy who had recurrent kidney stones who only addressed it with their kidney stone specialist and did not ever communicate it to their GI that this was going on. I think they ended up actually losing one of their kidneys, and it's all connected. So if we're going to be our own biggest advocates, we as patients need to start asking these questions, and we need to step forward and inform our providers of what is going on. This is what it means to be in charge of your healthcare. This is how we close the gap.